Hi friends, this is Dr. Anugraha here, and today's topic is few important topics from external ear. Okay, see, tell me what are the parts of ear? We have external ear, then we have the middle ear, then we have the inner ear. You know, right? Look at this picture, very simple. See, ENT is very simple, but if you try to mug it up, okay, learn it by heart, then it might help you to pass the exam, but then the subject is not going to be interesting. You know, for learning ENT, you have to imagine things, 3D imagination, okay? So, ear has got three parts. External ear, you see here, see in this picture, okay, this brown color area, that is the external ear, simple. This purple color area that you see here, okay, purple color area, that is the middle ear. And this inside part, okay, the inside part, that is the inner ear. Okay, now today's class is on external ear, just the parts. Okay, so external ear has got three important parts. External ear has got three important parts. What are they? It has got the pinna, okay, it has got the external auditory canal and tympanic membrane. Repeat after me. External ear has got three parts. One, pinna. What is pinna? Pinna, see, the part of the ear that you see outside, okay, that you see outside, that is called as the pinna. The part of the ear, the external ear that is visible to you, that is the pinna. Okay, and right inside what you see here, that is a canal, external auditory canal. Okay, and you can see a membrane, beautiful membrane here. It looks like a mushroom to me. Yeah, okay, so it doesn't look like a mushroom. Okay, I bought mushroom from store today, so somehow it reminded me of this. Okay, see, this is the tympanic membrane. All right, now this pinna, okay, has got structures in it. We have something called as helix, antihelix, tragus. I'll tell you. Okay, you just need to identify. Sometimes they can give you image-based questions and ask you to identify. That's it. Okay, so now we'll go to the parts of the external ear. Very simple. Look here. Okay, so the part visible outside, that is the pinna. Okay, the outward curve that you see, that is called as the helix. What is it? Helix. Inside the helix, okay, parallel to the helix, inside another curved line is there, that is called as the antihelix. Can you see properly? Yes. Can you see another curved line inside? Yeah, that is the antihelix. Okay, now you can see, or you can touch and see your own ear. Okay, there is one projection here, this, very important, that is called as tragus. What is it? Tragus. Okay, now I'm sure you guys know this part where you pierce, now that is called as a lobule. Just above the lobule, you take your finger, okay, just above the lobule, you can feel a projection, that is called as the antitragus. This part, okay, don't get confused. See, look here, this is the tragus. Okay, this part you touch and see, this part is the tragus. Just above the lobule, okay, just above the lobule, there is a small projection, and that is called as antitragus. Okay, fine. Then you can see a bowl shaped structure, that's called as concha. Okay, and very important question they might ask from external ear. Okay, that is an area called as incisura terminalis. What is it? Incisura terminalis. I'll tell you what that is. Okay, I'll just show you the site of incisura terminalis, because you have to know few lines about that structure, that area. See, look here, the part between the helix, okay, this part of the helix, okay, that is called as the crux of helix or root of helix. Okay, so between the root of helix and the tragus, you have a depression. You touch and see between the root of helix. You understood what you mean by root? This area. See this area, that is the root of the helix or crux of the helix. So between that part and the tragus, there is a depression. You can feel it. Okay, touch. Yeah, that area is called as the incisura terminalis. Very important. What is it? Incisura terminalis. Okay. Now, one point about incisura terminalis is, first point, you know that external ear is made up of cartilage. You know that, okay? There are two areas in the external ear which are not made of cartilage. In those two areas, you won't get to see cartilage. Which are those two areas? One is incisura terminalis, okay? And the second part where you don't see a cartilage in the external ear is lobule. What is it? This part, lobule. So this is one MCQ. Incisura terminalis. So there are two parts in the external ear where there is no cartilage. External ear is made up of cartilage, but there are two areas in your external ear where we don't get to see cartilage. So those two areas are, one is incisura terminalis, okay, the depression here, okay, and the second area is the lobule. Okay. Now tell me, ear is made up of which cartilage? See, in anatomy you will be learning different types of cartilages. Okay. We have elastic cartilage, we have hyaline cartilage, we have fibrocartilage. One second, I think I've written it here, no? See, okay. We have different types of cartilage, guys. Hyaline cartilage, you know where you get to see hyaline cartilage? Nose. Okay, the nose you have hyaline cartilage. You have elastic cartilage where, you know guys, in the ear. Okay. And epiglottis. Okay. When we learn throat, we will talk about epiglottis. It is very important. So elastic cartilage, it is seen in ear and epiglottis. Okay. Then we have fibrocartilage, that is the strongest, the disc. Okay. Disc and all, it is made up of fibrocartilage. Understood? Now see, you can remember like elastic cartilage, E for E. Okay. So the pinna, it has cartilages. Which kind of cartilage? Elastic cartilage. Okay. And E for epiglottis. Elastic cartilage, you can also say epiglottis. Okay. Now hyaline cartilage, you can see in the nose. How will you memorize it? See, when we sneeze, what we do? Right? So you will remember, right? Sneeze, we'll do. So hyaline cartilage. Understood? Now they have asked us before, epiglottis, which cartilage it is made up of? Elastic cartilage. That you should not forget. Okay. So cartilage part is over, and the parts of the ear also you have learned. Okay. Now, two lines about incisura terminalis. Okay. See, why this part is important, incisura terminalis? Because this is the area, okay, when ENT surgeries, like ear surgeries are done, okay, if the surgeon wants to get into the middle ear, okay, or if he wants to do some surgery in the external ear, in the tympanic membrane, he can access those parts if he make an incision in the incisura terminalis. See, he can make incision, okay, in the incisura terminalis, okay, and then he can proceed inward to do the surgery of the middle ear or external ear. Understood? Now you might ask, what is the problem if he cuts the cartilage? See, incisura terminalis, that area does not have cartilage. Okay, so I'm telling you, if the surgeon wants to do surgery in the middle ear, external ear, he will prefer to make incision via the incisura terminalis and then go inside. Okay, so you might ask me, he can approach the ear through other areas also, right? The reason is, suppose he approaches the ear, if he gets into the ear by making cut in the cartilage area. Okay, suppose let us say the area which underwent the surgery, it gets infected. Okay, so the cartilage can get infected. If the cartilage gets infected, there is a chance that it can go into necrosis. So if cartilage undergoes necrosis, there is going to be deformity in the ear. Will that look good? No. So that is why when we want to do surgery, we will prefer the area. Which area? Incisura terminalis, because there is no cartilage. Okay, it is just like making an incision over the skin. Okay, so if we make incision over the cartilage, and if there is infection occurring later on, okay, then there is a chance that that area can undergo necrosis, right? It can lead to deformity. So why such complications? So the surgeon will prefer what? To enter the ear through which area? Incisura terminalis. Understood? Yeah. So that approach, okay, that approach where the surgeon makes the incision around the external auditory canal, okay, that approach is called as end oral approach. See, we can access the ear through the posterior side also. Okay, but if for any surgeries there are different ways of entering the ear. So I'm telling you, if the surgeon is entering the ear through the areas around the external auditory canal, through the area of incisura terminalis, then it is called as end oral incision. Understood? What is it? End oral incision. Or we can also call it as Lambert's incision. Fine. Okay, now another important point about, so that's all about incisura terminalis. Another point about ear lobule is, see, this part from the lobule, okay, we can take fat, okay, and use it as graft, right? So we have certain surgeries, okay, in the ear, and some defects may need to be closed using fat. Okay, so that fat, where do they take it from? From the lobule. So ear lobule, that can be used for taking the fat graft. Understood? Fine. So I think that's all. Now tell me the answer. Incisura terminalis is located between tragus and antitragus. Is it? No. Tragus and crux of helix? Yes, that's the answer, right? Tragus and crux of the helix. Look here. 1 second. Okay, look here. Where is incisura terminalis located? Very important, yeah. Okay, this area is called as a crux of helix. This projection here is called as a tragus. The area that you see in between, that is the incisura terminalis. Understood, guys? Yeah. Okay. So that's all about today's class. Yeah. And okay, I want to talk to you guys about something that I saw today. Okay, it's nothing academic, but if you have time to spare, do listen. Because I believe that books you should learn from your environment also. So I happened to see something today. My maid was coming to my flat, okay, and we have to write it down. Security she just walked in, and then she's a little illiterate. Security started shouting at her. Okay, he's a nice man, but I don't know, he just started shouting at her. I happened to be there, and then she just smiled, okay, and then she went to my flat, and then so I told this man, see, please don't shout, you can always be polite, right? So he was like, why, she's just a maid. Okay, so I said, no, she's my guest. Even though she's a maid, she's my guest, so kindly be polite. So that's what I want to tell my students also. Be good regardless of others' position. ഇപ്പം നമ്മുടെ ടീച്ചേഴ്സിനോട് അല്ലെങ്കിൽ നമ്മുടെ ബോസിനോട് എന്തായാലും ആൾക്കാർ നല്ലതായിട്ടേ പെരുമാറുള്ളൂ. ബട്ട് ഹൗ യു ട്രീറ്റ് യുവർ സബോർഡിനേറ്റ്സ് അല്ലെങ്കിൽ people who are vulnerable, that adds to your character. And I want my students not just to study the books, but ഹാവ് എ ഗുഡ് ക്യാരക്ടർ. ഓൾറൈറ്റ്. ഇപ്പം നമ്മുടെ ഇപ്പോൾ ഒരാൾക്കൊരു അസുഖമുണ്ട്, ഓക്കെ, അത് കാരണം അപ്പം സെക്യൂരിറ്റി പറഞ്ഞു ഹി ഹാസ് ഗോട്ട് ദിസ് ഹാർട്ട് ഇഷ്യൂസ് എന്നോ, അതിൻ്റെ ഒരു ദേഷ്യം കാണിച്ചതാണ്. ബട്ട് സ്റ്റിൽ ഒരാളുടെ അസുഖം കാരണം അത് നമുക്ക് വേറൊരാളെ വേദനിപ്പിക്കാനുള്ളൊരു റൈറ്റ് അല്ല, റൈറ്റ്? സോ യാ, ഓൾവേസ് ബി ഗുഡ് ടു അതേഴ്സ്, റൈറ്റ്? Yeah. And so that's all about today's class, guys. I'll see you all tomorrow if time permits, or at the earliest. So please give me your feedback. Yeah, stay happy, stay healthy, and yeah, eat healthy.